it's me again, your student nurse for today, Camille Rosaliego. And now, I will be going to demonstrate on the parenteral medication. Before we proceed to the procedures in doing the parenteral medication, let us know first what is parenteral medication. Parenteral medication are given through a route other than alimentary canal. There are 4 routes: the intradermal, the subcutaneous, the intramuscular, and the intravenous. Intradermal is the administration of a drug into the dermal layer of the skin, just beneath the epidermis. The subcutaneous is the administration of drug into the subcutaneous tissue. The intramuscular is an injection into muscle tissues. And lastly, intravenous, it enters the client's bloodstream by way of a vein. There are 2 frequently used to pack the sterile solution or sterile parenteral solution, that is the ampule and the vial. An ampule is a glass container usually designed to hold a single dose of a drug. It is made of clear glass and has a distinctive shape with a constricted neck. The vial is a small glass bottle with a sealed rubber cap. Now, let's go in preparing medication from ampules. First, you need to perform hand hygiene and observe other appropriate infection control procedure. This is to prevent cross-contamination. Then, you need to prepare the medication ampule for drug withdrawal. This is to make the whole procedure smooth flowing. Then, you need to flick the upper stem of the ampule several times with a fingernail. The rationale for this will bring all the medication down to the main portion of the ampule. Then, place a piece of sterile gauze between your thumb and the neck of the ampule. The sterile gauze will protect your fingers. Then, you need to break off the top by bending it toward you, and you need to ensure that the ampule is broken away far from you and far from the others. This is because any blast fragments will spray away from the nurse. Then, dispose of the top of the ampule in the sharp container to ensure safety. Then, place the ampule on a flat surface to withdraw the medication. Attach the filter needle to the syringe. The filter needle or straw prevents glass particles from being withdrawn with the medication. Then, you remove the cap from the filter needle and insert the needle into the center of the ampule. This will keep the needle sterile. Withdraw the amount of drug required for the dosage to ensure the right dosage is given. Then, after you withdraw the drug, you need to dispose the needle by placing it in a sharp container to ensure safety. Then, replace the filter needle. Tighten the cap at the hub of the needle and push solution into the needle to the prescribed amount to withdraw the medication. Now, let us go in preparing medication from vials. First, you need to perform hand hygiene and observe the appropriate infection control procedures. This is to prevent infection and cross-contamination. Then, mix the solution by rotating the vial between the palms of the hands. Some vials contain aqueous suspensions which settle when it stands. In some instances, shaking is contraindicated because it may cause the mixture to foam. Then, remove the protective cap or clean the rubber cap of a previous open vial with an antiseptic wipe by rubbing in a circular motion. The antiseptic cleans the cap and reduces the number of microorganisms. Then, attach the filter needle to draw up pre-mixed liquid medications from multi-dose vials. Using the filter needle prevents any solid particles from being drawn up through the needle. Now, remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. The rationale for this is to withdraw the medication. Carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Use a withdrawing needle to avoid dull needle with injecting the client. Inject the air into the vial, keeping the bevel of the needle above the surface of the medication. The rationale for this is the air will allow the medication to be drawn out easily because negative pressure will not be created inside the vial. The bevel is kept above the medication to avoid creating bubbles in the medication. There are two ways of withdrawing the medication. Either holding the vial down, moving the needle tip so that it is below the fluid level. This is the rationale for this is proponents of this method say the keeping of the vial in an upright position while withdrawing the medication allows particulate matter to precipitate out of the solution. The next is inverting the vial, ensuring the needle tip is below the fluid level and gradually withdraw the medication. The rationale for this is keeping the tip of the needle below the fluid level prevents air from being drawn into the syringe. Now, let us move on to administering an intradermal injection for skin test. So, this method of administration is frequently used for allergy testing and tuberculosis screening. Common sites for intradermal injections are the inner lower arm, the upper chest, and the back beneath the scapulae. First, you need to perform hand hygiene, observe the appropriate infection control procedures. This is to prevent infection and cross-contamination. Then, prepare the medication from the vial or ampule for drug withdrawal to make the process smooth flowing. Remember to introduce yourself and verify the client's identity. This is to ensure that the right client receives the right medication. Then, explain to the client that the medication will produce a small wheel. This is the information can facilitate acceptance of and compliance with the therapy. Then, provide a privacy. This is to promote client's integrity. Then, you need to select a site. This is to ensure the medication is given to the right route. Then, you need to cleanse the skin at the site using a firm circular motion starting at the center and widening the circle outside. This is to clean the site. Now, remove the needle cap while waiting for the antiseptic to dry. This is to prepare the syringe for injection. Then, expel any air bubbles from the syringe. A small amount of air will not harm the tissues. Then, grasp the syringe in your dominant hand, close the hub, hold it between your thumb and your forefinger. This is the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. Then, hold the needle almost parallel to the skin surface with the bevel on the level up. This is the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. With a non-dominant hand, pull the skin at the site until it is taut. The rationale for this is taut skin always for easier entry of the needle and less discomfort for the client. Insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. This is to inject the fluid. Then, stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheel on the skin. The rationale for this is to verify the medication entered the dermis. Then, withdraw the needle quickly at the same angle at which it was inserted. This is to ensure safety. And lastly, do not massage the area. Massage can disperse the medication into the tissue or out through the needle insertion site. Now, let us move on in administering a subcutaneous injection. The purpose for this is to provide a medication the client requires and to allow slower absorption of medication compared with either the intramuscular or intravenous route. First, perform hand hygiene and observe the appropriate infection control procedure. This is to reduce the transmission of microorganisms. Then, prepare the medication from the vial or ampule for drug withdrawal. This is to ensure correct medication preparation. Then, you introduce yourself and verify the client's identity and provide privacy. This is the rationale for this is it provides privacy to the client and ensure the medication is given to the right client. Then, you assist the client in a comfortable position. A relaxed position of the site reduces discomfort. Then, explain the purpose of the medication, including relevant information about the effects of the medication. Information can facilitate acceptance and compliance with the therapy. Then, select a site free of tenderness, swelling, scarring, itching, burning, or localized inflammation, and one that has not been frequently used. The rationale for this is these conditions could hinder the absorption of the medication and may also increase the likelihood of injury and discomfort at the injection site. Then, you need to put on clean gloves. This is to reduce the number of microorganisms. Then, clean the site with an antiseptic swab. Start at the center of the site and clean in a widening circle to about 5 cm and allow the area to dry. The rationale for this is the circular motion and mechanical action of antiseptic swab removes the skin debris which contains microorganisms. Then, place and hold the swab between the third and fourth fingers of the non-dominant hand. The rationale for this is using this technique keeps the swab readily accessible when the needle is withdrawn. Then, you remove the needle cap by pulling it straight off. The rationale for this is the needle will become contaminated if it touches anything but the inside of the cap, which is sterile. Then, hold syringe between thumb and forefinger of the dominant hand. The rationale for this is quick, smooth injection is easier with proper position of syringe. Then, pinch skin with non-dominant hand. Needle penetrates tight skin easier than loose skin. Pinching skin elevates subcutaneous tissue. Then, you need to release the skin. Grasp the lower end of the syringe with non-dominant hand and position the dominant hand to the end of the plunger. Do not move the syringe. Injection requires smooth manipulation of syringe parts. Moving of syringe may cause discomfort to the client. Then, pull back on the plunger to ascertain that the needle is not in the vein. Aspiration of blood indicates intravenous placement of needle, so procedure may have to be abandoned. Quickly withdraw the needle while applying pressure with the antiseptic pad. Supporting tissue around injection site minimize discomfort. Then, assist the client to a comfortable position. This is to promote comfort. Then, discard the uncapped needle and syringe in a disposable needle container. This is decrease of needle stick injuries. And remove gloves and wash hands. This is to reduce the transmission of microorganisms. Then, document all relevant informations. Now, let us go in administering an intramuscular injection. A major consideration in the administration of IM is the selection of safe site located away from large blood vessels, nerves, and bones. First, perform hand hygiene and observe the appropriate infection control procedures. This is to reduce the number of microorganisms. Prepare the medication from the vial or ampule for drug withdrawal. This is to ensure the correct medication preparation. Then, you need to provide privacy. This is to reduce the distraction. Distraction reduces anxiety. Introduce self and verify the client's identity. This ensures that the right client receives the right medication. Next, you assess the client to a position depending on the chosen site. For vastus lateralis, lie flat or supine with knee slightly flexed. For retrogluteal, lie on the side or back with knee and hip slightly flexed. For dorsogluteal, lie prone with feet turned inward or on side with upper knee and hip flexed and placed in front of the lower leg. The rationale for this is the appropriate positioning promotes relaxation of the target muscles. Then, you explain the purpose of the medication, including the relevant information about the effects of the medication. The rationale for this is the information can facilitate acceptance and compliance with the therapy. Then, you need to select a site free from skin lesions, swelling, tenderness, or localized inflammation, and one that has not been frequently used. The rationale for this is to reduce the discomfort of intramuscular injection. Then, locate the exact site for injection. The rationale for this is avoid injury to underlying nerves, bone, or blood vessels. Then, you need to put on clean gloves to reduce the number of microorganisms. Then, you need to clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 cm and allow the area to dry. The rationale for this is the circular motion and the mechanical action of antiseptic swab removes skin debris which contains microorganisms. Then, remove the needle cover and discard without contaminating the needle. This is to prevent contamination. Use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters to the side. The rationale for this is pulling the skin and subcutaneous tissue or pinching the muscles makes it firmer and facilitates needle insertion. Hold the syringe between the thumb and forefinger of the dominant hand. Inject needle quickly and firmly at a 90-degree angle and insert the needle into the muscle. The rationale for this is using a quick motion lessens the client's discomfort. Then, hold the barrel of the syringe steady with your non-dominant hand. Aspirate it by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. The rationale for this is if the needle is in a small blood vessel, it takes time for the blood to appear. If blood vessels appear in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. Slowly inject the medication. The rationale for this is injecting medication slowly promotes comfort and allows time for tissue to expand and begin absorption of the medication. Holding the syringe steady minimizes discomfort. Quickly withdraw the needle while applying pressure with a dry sponge. The rationale for this is this minimizes tissue injury. Use of one alcohol swab may cause pain or a burning sensation. Then, assist the client to a comfortable position. This is to promote comfort to the client. Discard the uncapped needle and syringe in a safe receptacle. The rationale for this is this decreases the risk of needle stick injuries. Then, remove gloves and wash hands. This is to reduce the number of microorganisms. Then, you need to document all relevant information.